Okay, I think we might be able to begin now. So I'll begin by introducing myself. I'm Alan Barrett. I'm the director of the ESRI, and it's a great pleasure to welcome everybody today to our webinar on risk and protective factors in adolescent behaviour. So we've a pretty packed agenda over the next hour or so. So the core of the webinar today is to hear a presentation on the results of the latest output using the Growing Up in Ireland data. But before that, we're going to have some opening remarks from Minister Roderic O'Gorman, and it's a great pleasure to welcome the Minister to the event today. So my colleague Emer Smyth will take us through the report, and also delighted to say that we'll have a response from Sharon Eustace, and Sharon is with the National Educational Psychological Service. So in keeping with how we've tried to do things at recent webinars, we'll have the presentation of the research findings, and then observations from, as I described, somebody closer to the coalface, if we can put it like that, a practitioner who'll add some insights. We should have some time towards the end for Q&A, so we'll use just the Q&A function at the bottom of the screen if you want to submit questions, and I'll try and pass them on to Emer, Merike, and Sharon might answer a few of the questions as well. So always a great pleasure. Over the years, we've run so many events now with our colleagues in the Department of Children, with great tradition, mainly I suppose through the Growing Up in Ireland survey, that there's been a strong link between the ESRI and the department, and that means of course that we've had a pleasure of welcoming many ministers over the years to speak at these events. Minister O'Gorman has been kind enough to speak at some events already, and it's always a great pleasure to welcome him and to hear his insights. So with that, Minister O'Gorman, can I hand the floor over to you?
That's great, Alan. Can you hear me all right there?
Can indeed, yeah.
Brilliant. Thanks very much. Well, listen, thank you for that warm welcome, and appreciate the invitation from the ESRI to speak at the launch of this report today. I'd particularly like to thank Professor Emer Smyth and her co-author, Dr. Merike Darmody, for providing me with this opportunity to launch this most recent report of that ongoing cooperation between my department and the ESRI, looking at risk and protective factors in adolescent behaviour. And as you're aware, my department and the ESRI have a research partnership, and the purpose of that is to generate policy outcomes and I suppose outputs that are particularly focused on supporting public policy developments in the area of children and youth. And I think the degree to which the research partnership has met its particular remit is apparent from this report and a number of others that are due to be launched in the coming months. And I hope to speak at some of those launches as well. And I'm very glad that in light of that significant body of work that is emerging from the partnership, to say that it has been agreed that this research partnership will be extended up until 2023. And today's research actually draws from another successful partnership between this department and the ESRI in the context of Growing Up in Ireland, the longitudinal study of children in Ireland. And I think in the research being launched today, it yet again emphasises the importance and the strength of the Growing Up in Ireland survey as a longitudinal approach to data collection, because the authors have been able to draw on various data sets. So they've been able to engage with the 98 cohort when they were 9, when they were 13, and again when they were 17. And they've been able to use that constant engagement with the same cohort to build a dynamic model of behavioural development of young people in Ireland. And actually, when I first became a minister last year, the report on the lives of 17 and 18-year-olds was one of the first pieces of was one of the first launches I did as minister. And that report was actually quite positive, as I recall, and it showed that for the most part, 17 and 18-year-olds were faring well. They were generally in good health. They had strong educational aspirations, and they actually played quite an active role in their communities through volunteering. But it did also set out some areas for concern, some issues around depressive symptoms. There were some issues in terms of excessive alcohol use, and some evidence of discrimination as well, which is obviously also very relevant to the work of my department. And it also set out some inequalities that were very much linked to a person's social background. And I think one of the important policy questions that was raised by that report last year is how can we as a society support young people to avoid risky and problematic factors, and particularly what as government can we do on a public policy level to address that. And as a means of addressing these questions, my department engaged further with Emer and Merike from the ESRI in order to explore these factors further and look at what were the protective factors for adolescent behaviour. How can we stop adolescents leaving, I suppose, the path of good and productive lives? And if they do step off that path, what can we do to assist them re-engage? And as Minister, I'm very much conscious that a lot of the time that we're talking about adolescents and particularly adolescents' behaviour, it's very much focused on remedial actions, ensuring they're effective and fair. But we're all often dealing with kind of after the fact reactions. I think obviously they're very important. It's vital that they're fair and proportionate. But I think if we can spend more time on that preventative element, engaging with young people and preventing them from undertaking risky or problematic behaviour, I think that is as important, if not more important, an investment of state resources. And this report today reminds us that most 17-year-olds, like the rest of the population, they're generally doing well, they're generally making a positive contribution, and a few consistently act out at home or in school or in the community. And in reading the report before the launch today, and maybe just before we hear from the authors themselves, I wanted to reflect maybe on two particular findings that impacted on myself. And first of all, due to the longitudinal nature of the Growing Up in Ireland study, we can see children, and we can see the same cohort of children, we can see their behaviour change as they go from childhood into adulthood, 7, 13, and 17. And we see their behaviours are different at each step as they go. And that shows us that we can't predict problematic behaviour from behaviour that occurred earlier on. So a child who might have been in difficult circumstances at the age of 9, that isn't necessarily predictive that same child will be engaged in problematic behaviour when they're 17. I think only about 3% of children were seen as in that problematic cohort in all 3 stages of the research. So particularly then, let's say, look at antisocial behaviour, and that's defined by the authors as behaviour in the community, such as graffiti or damaging property. And the author shows that partaking in this paper at 13 only slightly predicts wider antisocial behaviour 4 years later at 17. I think that's really good news for any parent who's struggling right now with perhaps difficult or risky behaviour by their child or by their team, because it suggests that behaviour won't last forever and it will be resolved. And I think it's also good news for policymakers as well, because it hopefully demonstrates that where interventions are taking place through school, through youth services, through other routes, these interventions are successful and they are changing children's and young people's behaviour. And I think it's an absolutely central job of my department and this government as a whole to support young people, to help them maximise their potential. And obviously at no point should any child be written off just because for a period of time they've been engaging in problematic behaviour. The weak link between earlier and later problematic behaviour raises other questions. If it's not inevitable that earlier behaviour predicts later behaviour, then what does predict later behaviour, and what can we do now to actually to help young people? And in thinking about these questions, I might draw attention to the second point that really stood out for me from this particular piece of research, and that's the importance of a good adult, or as the authors put it, at least one good adult that a young person can talk to. And it doesn't matter where that person is. That can be a teacher in school, it can be a coach in a sports club, it can be someone involved in youth services, but having a having at least one adult consistently engaging with a young person is a very strong marker in terms of better behavioural outcomes for young people. And there was a real focus on the relationship between teachers and young people, and that the report shows that that's a very important factor in determining teenager behaviour. And so much so the school that a teenager goes to emerges as a better predicator of their behaviour than the actual neighbourhoods in which they lived. The report also emphasises the access to local facilities in a safe neighbourhood was found to have a protective effect on adolescents as well. And I think that fact for me was an important reminder of the absolute significance of youth services and the way in which they can impact in a really meaningful way on the lives of young people. And that's really been brought home to me in the course of the last year in the context of the work youth services have done. We know from the work that Spun Out did in conjunction again with my department that young people who were consistently engaging with youth services across the duration of the pandemic fared better. I was delighted in the budget for this year to be able to provide an extra €5 million investment into youth services, bringing it up to almost 70 million for this year. And I hope in future budgets to be able to continue to provide that financial support to youth services across the country. The report also emphasises the necessity of a holistic approach to supporting young people's well-being. And that's both a reminder of the department's legacy and its future. And despite the recent expansion of my department's remit, efforts to support the healthy development of children and our young people, they remain absolutely central to the work that this department is doing. But our new remit also allows an opportunity to think about the diverse realities that children and young people live in Ireland today. As the authors note, the children of a parent with disabilities, they face particular challenges. And this tells us that we need to support all parents and children, but particularly those with facing a physical disability or a mental health issue. And it also tells us that these concerns can only be addressed through a continuum of intervention, from early prevention to targeted specialist supports for those who have more serious difficulties. And one of the key goals of the Growing Up in Ireland study is to grow the body of knowledge about what is typical and normal as children and young people develop. But we also want and we need to understand what sort of behaviour is atypical, what sort of behaviour is problematic. And the work that the authors have done in this report realise that key objective in important ways. And that work is going to provide an important resource for my department and indeed across government for all of those of us who are working on that on a day-to-day basis to improve the lives of young people in Ireland. So just want to say again, thank you for the ESRI for the opportunity to speak here today. Congratulations to the two authors and the team behind them. It is a really important piece of work, and it adds to the wider body of work and the real importance of that research partnership that exists between my department and the ESRI.
Great, thanks so much for that, Minister, and thanks for engaging so deeply with the details of the research. It is, I know, speaking on behalf of the authors, it's always very rewarding when the Minister comes to give a speech and has actually sort of thought and reflected on the research, and it's great to hear that it'll be sort of filtering and moving its way through the department and policy discussion. So we really do appreciate that. So, Minister, I'm sure you're very busy, and which suggests that you may not be able to stay for the presentation, which is a pity. But anyway, we always understand that, and again, we're delighted that you were able to come along. And I've probably said this 2 or 3 times before, we're very much looking forward to actually welcoming you to the building at some stage. We might even have a cup of coffee before the event. But anyway, all in good time. So listen, thanks so much again, though. Appreciate it, your time here. Bye-bye. Okay, so with that then, I'm going to call on Emer Smyth, my colleague. And yeah, I see you're sharing your screen already, Emer, which is great. And we look forward to hearing you talking about the detailed results.
Thank you, Alan. So I'm presenting on behalf of my co-author, Merike Darmody, and myself, and we'd like to start by kind of giving our thanks, first of all, to the Minister for agreeing to kindly launch the report, and to the research partnership that has been engaged in by his departmental colleagues, which has been allowed us to exploit Growing Up in Ireland data. None of this would be possible without the beautiful data provided to us by the Growing Up in Ireland study team, and also facilitated by the participation and engagement of young people and their families. So I just want to start by telling you a little bit about the background to the study. We used the older cohort, cohort 98, to examine a set of research questions. First of all, the patterns of behaviour and misbehaviour that were found among young people at 9, 13 and 17 years of age. But we wanted to go beyond documenting those patterns to see whether they were related to differences in family resources, to differences in the social mix of the school, and to differences in the social composition of the neighbourhood. And as the Minister pointed out, for policy, in order to inform policy development, we also wanted to help identify those family, peer, school and neighbourhood factors which help to reduce the incidence of behaviour difficulties among adolescents. Now, we took a multidimensional approach looking at different kinds of behaviour. We asked mothers to report about the young person's behaviour at home. And here we had 3 aspects: externalizing difficulties. So this would be acting out or even hyperactivity. Internalizing difficulties that involve low mood, emotional problems and problems in interacting with peers. And one positive behaviour, which is pro-social behaviour, which looked at the extent to which young people interacted well with other people in their lives. We also looked at behaviours in school and the neighbourhood, and here we relied on the young people themselves to report about these behaviours. At school, they were asked about school-based misbehaviour. This could range from messing in class to getting into trouble for breaking rules or even being suspended from the school. We also asked about truancy, or mitching as we call it in Ireland, and we asked the young person to report on a range of antisocial behaviours, including graffiti, taking property or money with their permission, and up to more serious aspects like getting into fights where other people were hurt. Now, the overall pattern, as the Minister has pointed out, is that we actually see encouragingly low levels of behaviour difficulties at all 3 ages. And another interesting feature is that young people consistently act out across the domains of home, school and community. So that leads us to feel that we really need to understand young people's behaviour in context and look at how it's shaped and reshaped in different domains of their lives. We see both stability and change and difficulties over time. So early difficulties are a signal of potential later difficulties, but for most of the young people in the study, behaviour difficulties are temporary. Some kinds of behaviours are more persistent than others. We see that with externalizing difficulties, but some are less persistent or less stable, such as antisocial behaviour. So it may be that a young person would be engaged in antisocial behaviour at the age of 13, but if you like, they would grow out of that and have ceased doing so to the same extent by the age of 17. I'm just going to start by outlining some of the differences by gender and social background. We see very striking gender differences among the young people. Males tend to be more likely to engage in externalizing type behaviours. They act out more at home and at school, and they're more likely to engage in antisocial behaviour. In contrast, young women are more likely to turn those difficulties inwards. They experience more internalizing difficulties, but actually on the positive side, also more pro-social behaviour. And you can see from this chart that the red line are the young women, is that levels of internalizing difficulties are higher amongst females at 9 and 13, but the gender gap really grows between 13 and 17 in a manner that is quite concerning in terms of the implications for young women. The richness of the Growing Up in Ireland data meant we could take a multi-dimensional approach to looking at family background, looking at social class, parental education, household income and family structure. We actually find a complex picture in looking at the relationship between behaviour and disadvantage. We see that in households where parents and mothers have lower levels of education, that young people have more externalizing and internalizing difficulties, but there's no difference in their levels of school misbehavior or antisocial misbehavior. We also see the financial strain, and this group was one that lived through the recession, and some of that strain was related to recessionary conditions, is related to external and internalizing behavior at home, but also young people in kind of families experiencing levels of financial strain often act out at school. For parents who started off as lone parents or who separated in the course of the study, we see poorer behaviour outcomes for these young people across all of the domains we looked at. And these differences aren't accounted for by differences in financial strain, social class or parental education, and would merit further investigation. One of the interesting features we wanted to look at in this study was the extent to which adolescent behaviour is shaped by schools and or neighbourhoods. Now, Ireland is kind of interesting in this respect. In many countries, almost all young people attend their local school. So it makes it very hard to distinguish between the effects of the school they attend and the neighbourhood they live in. In Ireland, in contrast, around half of those in the second level education don't attend their nearest or most accessible school. So there's no simple mapping between school and neighbourhood. For that reason, we use a technique called cross-classified multi-level modelling to distinguish school and neighbourhood effects. And that means we can see how much behaviour varies across individual schools and individual neighbourhoods. Now, when we do that, we find that there is very significant variation between individual second level schools in a number of different kinds of behaviour. So in school-based misbehaviour, truancy, internalizing difficulties, and positive pro-social behaviour, even when we take account of the family background and gender of those attending those schools. We see very little difference by school social mix, but we do see lower levels of misbehaviour in single-sex schools, especially girls' schools, and lower truancy rates in girls' schools, all else being equal. Now, I mentioned that one of our key research questions was about the effect of school social mix. So at second level, we distinguish between DESH schools that receive additional supports because of their socioeconomically disadvantaged profile of students, fee-paying schools, and other non-DESH schools. And we also have information on these young people in terms of the primary school they attended. So here we distinguish between all other schools and urban band DESH primary schools. And these would be the most deprived urban primary schools. So what this chart shows is the net difference made by school social mix on behaviour at home. The more negative externalizing and internalizing behaviors and the positive pro-social. So what we see is that for all of these behaviors, levels are higher in DESH than non-DESH schools, even taking account of the different social profile of those students. So those attending DESH schools have more internalizing and externalizing difficulties, but they also show more pro-social behavior. But even when we look at the second level schools that young people attend, we see that there's a legacy, if you like, of their primary school. So those who had been at the most deprived primary schools, urban band 1 schools, also have greater difficulties in negative behaviours, but also pro-social behaviour as well. Turning to school-based and community-based behaviour, we see again that DESH schools have higher levels of school-based misbehaviour and higher truancy rates, as well as higher rates of antisocial behaviour than non-DESH schools, with some additional effects of having attended an urban band 1 primary school. But an interesting feature that we see here is that fee-paying schools emerge as distinctive in 2 respects. They have higher levels of truancy than you might expect given their levels of advantage, and they have somewhat higher levels of antisocial behaviour than those in other non-DESH schools. Looking at neighbourhood, I mentioned that we could disentangle what was going on between schools and between neighbourhoods. And interestingly, we find there's more variation between schools than neighbourhoods. So schools matter more in shaping adolescent behaviour in Ireland than neighbourhoods. But there are some differences too evident at the neighbourhood level. If we take account of the profile, the socioeconomic profile of the neighbourhood using objective census-based information, we see that young people living in the most disadvantaged areas tend to have more externalizing difficulties. We also see that the subjective experience of a neighbourhood, how it's viewed by parents, make a difference. So parents who reported that their neighbourhood was more disorderly, so if you had things like graffiti, but also more public drinking and drug taking, young people in those areas had more externalizing and internalizing difficulties and had lower levels of pro-social behaviour. We also see higher levels of antisocial behaviour in areas where parents expressed concern about local gangs. We also see some variation by the type of area. So we see on average higher levels of behaviour difficulties in larger cities or small towns compared to rural areas. Now, in terms of policy, probably the most important aspects of the study are what it shows us about what can help protect young people from behaviour difficulties. And we looked at a number of sets of factors. The first of these was family factors. And in keeping with research that Elizabeth Nixon did on this group at 13, at 17, we also see that conflict with parents is a risk factor for behaviour difficulties. Positive relationships are actually less significant as an impact, but that's because there's actually less variation. We tend to see quite positive relationships between parents and young people across the board. But where there are positive relationships, we see more pro-social behaviour and less truancy. We also see that where parents engage in more monitoring, so where they know where the young person is going in the evenings or weekends, and they know who they're with, that we tend to see fewer behaviour difficulties here. Peer factors are interesting because a large friendship group operates as a protective factor in reducing low mood and reducing senses of isolation, but it's also a risk in terms of acting out at home, in the community or in school. And that seems likely to be related to kind of, if you like, showing off for a larger audience of peers. Having older friends as opposed to friends your own age or younger friends is an additional risk factor, which we saw in earlier research with Anne Nolan also emerged in terms of health behaviours. The quality of friendship also matters, with trust in friends having a protective factor and alienation or negative interaction kind of resulting in behaviour difficulties. As the Minister pointed out, school emerges as a very important influence on adolescent behaviour, so that young people who've experienced positive interaction with teachers where they've been given praise and positive feedback tend to have fewer behaviour difficulties. And on the other hand, we see that those young people who experience being given out to a lot by teachers who don't like school, who don't like their school subjects and are underperforming academically, they tend to have greater behaviour difficulties, even taking account of earlier difficulties, so that there is a direct kind of effect, if you like. In terms of neighbourhood, as the Minister pointed out, having one good adult, or at least one good adult, it has a strong protective effect. So if someone can talk to their parent, or someone at school, or a youth worker, or even a neighbour about their problems, they tend to have fewer difficulties. Having a safe place to hang out, access to facilities, and being involved in more structured sports like clubs or teams also helps protect young people from behaviour difficulties. Now, I've covered quite a lot, so I just want to kind of take a few minutes to kind of point to some of the main implications that we have here. And I know that Sharon will be able to tease out some of these by referring to the Department of Education policy in this domain. What Merike and I have tried to show in this report is that we really need to understand adolescent behaviour in context and how their behaviour reacts to different risk and protective factors in different domains of their lives, rather than assuming that a young person, if you like, is a troublemaker across all domains. The study findings support the need to take a holistic approach to looking at young youth mental health and well-being, and that's very much in keeping with the kinds of approaches that have been taken with the Sharing the Vision mental health policy. So in that way, we need a continuum of supports from early prevention, but also having specialist supports for those with more severe difficulties in order to avoid longer term problems. And this can be challenging because, as research by Youthreach and other ESRI colleagues have shown, there is a significant level of unmet demand for child and adolescent mental health services even prior to the pandemic. Schools emerge as a really important arena for intervention, as well as an influence on young people's behaviour. We've seen a renewed focus on well-being as a curriculum area in primary school and in second level, but there probably is more scope, we would think, to look as part of the senior cycle review, to look at how well-being can be embedded more securely in senior cycle, and especially in the preparation for the Leaving Certificate. It's very clear from the study findings that any supports put in place are only going to be effective if they're underpinned by a positive school climate, where you have positive interaction between teachers and students, and move away from an emphasis on kind of punitive measures or suspensions and detention and so on. School also needs to be an engaging learning experience for young people in order to kind of help reduce difficulties. There is space to provide professional development for teachers and other professionals working with children and young people to help them identify the drivers of misbehaviour, and this could build on existing work being done by the education centres and by organisations such as Jigsaw. The research adds to the body of evidence pointing to the need for significant investment and support for Dutch schools, and in particular we'd highlight the potential role of the school completion programme in providing such supports for children and young people with behaviour difficulties. The findings on financial strain point to the kind of need for any education and kind of wellbeing interventions to be located within a broader anti-poverty strategy. Finally, it's worth saying that, you know, this research relates to the period before the pandemic. These young people were surveyed in December of last year, and we saw at that stage very significant mental health difficulties and an increase in such difficulties since the pre-pandemic period. So the impact of the pandemic and related restrictions really makes policy response to the issues emerging from the study all the more urgent. So I'd like to thank you very much for listening, and hopefully we get a chance to kind of have some time for questions and answers, and I'm very much looking forward to Sharon's policy response to our work. Thank you very much.
Great, thanks so much, Emer. Congratulations on a great presentation and a great report, and obviously including Merike in that congratulations as well. Okay, so now it's a great pleasure to welcome Sharon Eustace to the Institute's webinar. As I said earlier on, it's great to have a practitioner's response to the sort of research we're producing. So we're looking forward to hearing Sharon's views. And before you begin, Sharon, can I just say to people, if they want to start submitting their questions through the Q&A function, we will have a little bit of time, and I'll try and moderate a sort of Q&A so people can be typing in those questions. So with that, over to you, Sharon.
Thanks, Alan, and thanks, Emer, for such a comprehensive overview of the research. I'm just trying to get this up as slideshow. So,
Sharon, there's a thing on the slide that says resume slideshow.
Yeah, okay, great, super. It's great to have somebody to assist me. Delighted to be here and just to say that the department congratulates Dr. Emer Smyth and Dr. Merike as well on such an extensive and comprehensive piece of research. And we welcome that the report recognises the importance of schools in influencing adolescent behaviour and in providing interventions and supports for young people. Also really important that the report gives recognition to the important role that schools play in the continuum of care for young people, but also acknowledge that the accessibility to adolescent mental health services is key for a certain cohort that experience more serious behaviour and mental health difficulties. And we also recognise this in the department, and we are liaising with our partners in health in relation to the National Mental Health Strategy mentioned earlier, sharing the vision, and the signposting of resources and supports for young people in need of further supports. The report highlights the importance of taking a holistic approach to young people's behaviour and how it is influenced by the context in which these young people exist in. And the department's wellbeing policy and framework for practice likewise recognises the importance of a holistic approach to wellbeing promotion in education. Like the current study, the wellbeing policy of the department adopts the Bronfenbrenner's ecological model to emphasize that the well-being of young people is everybody's business and is shaped and reshaped by the context in which they interact with others on a daily basis. The wellbeing policy outlines a comprehensive whole school approach to well-being and positive mental health, and it focuses on supports for the whole school community as well as for groups and individual young people with identified needs. Schools have been and continue to promote well-being through a range of activities and approaches to support the academic, physical, mental, emotional, social and spiritual development of all children and young people. In the department, a wellbeing office in NEPS has been established, and the office has responsibility for the implementation of the wellbeing policy. We have also convened a wellbeing interagency group, which includes a range of education support services and agencies. And this group facilitates the alignment of a comprehensive body of wellbeing supports to the school communities. I just noticed that I was on the wrong slide there, so I'm back on track here. Okay, just in relation to the report, we welcome the report's recognition of the importance of initiatives and supports in education, such as the requirement for all schools to engage in a wellbeing promoting process using the school self-evaluation system of the department inspectorate. The inclusion of wellbeing as an area of learning in junior cycle. And also just in relation to the senior cycle review, which Emer mentioned earlier, the NCCA, as you know, have undertaken a significant review of senior cycle, and this review included provision across a number of international jurisdictions and an extensive consultation process involving teachers, parents, guardians and students to look at the areas of strength and the areas for further development. An advisory report looking at priority areas, longer term goals and a proposed timeline and advice on the pace and scale of developments in senior cycle will be received by the Minister from the NCCA in the coming weeks. Another important support in schools, in post-primary schools, is the guidance counsellor. And this year, the department introduced an additional 120 guidance posts to support the well-being of students. And I suppose this was, we mentioned earlier that the space has changed in well-being over the last year with COVID. So this was in a response to the emerging needs of students in COVID times. Also, my own service, psychological service of the department, NEPS, has been expanded this year to include 17 new psychologist posts. So we're delighted about that. As you know, homeschool liaison scheme has been available in DESH schools for quite a time, and this is available to all DESH urban band 1, band 2 and DESH post-primary schools. And the homeschool liaison program, this offers school-based interventions to address the needs of students and their families in disadvantaged areas through acknowledging the developing role of parent as primary educator. And I suppose the current research highlights the importance of parent involvement and the importance of parent mental health and well-being for outcomes for children. And I will talk in the next slide about the school completion programme, which again was mentioned in the research. There's many important findings in the report, some positive and some concerning, and we in the department and NEPS, we will be reflecting on how we can best respond to these going forward. In relation to the DESH programme, which is the main policy initiative of the department to address educational disadvantage at school level, there are 887 schools in DESH primary in the DESH programme, and this is targeting over 185,000 pupils. The total department spend on DESH in 2021 is over 150 million, and this includes over 26 million for the school completion programme, which focuses on targeting and providing supports to young people identified to be at risk of early school leaving. The Minister also recently announced additional funding to extend the school completion programme, which was suggested in the report. And this will include a further 14 urban primary and 14 post-primary schools. An additional 5 million annual funding for the school completion provides a 5% increase in funding to this programme. So just finally, it is hugely important for us in education to be aware of the risk and protective school factors in adolescent behaviour, such as school policies, a positive school climate, relationships with peers and with teachers, and the impact of receiving praise and positive feedback. We are reassured that these areas that have been highlighted have also been highlighted in the 4 key areas of the wellbeing policy of the department, and we're encouraging schools in the wellbeing promotion process to look at these 4 key areas. They are culture and ethos, curriculum, teaching and learning, relationships, and policy and planning. In line with previous research, as was mentioned earlier, having at least one good adult in the lives of young people emerges as an important key protective factor, and again highlights the importance of the teacher in the child's life and the ongoing professional development for teachers. The professional development service for teachers of the department, their work plans for next year include CPD and sustained support for teachers in the areas of restorative practice, and also a national rollout of CPD and sustained support on implementing the wellbeing policy using the school self-evaluation system. NEPS also continues to run evidence-based programs such as the Incredible Years Teacher Classroom Management Programme and the Friends for Life Resilience programs. The focus of these programs being on relationships. NEPS is also currently developing a range of workshops for teachers on the promotion of wellbeing and resilience in schools, which includes trauma-informed approaches. And just finally, we are very aware in the department, as mentioned in the report, that COVID has impacted on the mental health and well-being of us all and of young people. And that now more than ever, it is so important that we are aware of what impacts positively and negatively on our young people, so that we can continue to be responsive to their needs in education. Thank you. I'll stop sharing now.
Great. Thanks so much, Sharon. I learned a lot from this. Is an area I keep an eye on. Just a huge amount of activity happening in the area. So I have to say congratulations to you and your colleagues for all the work that's been done, and thanks for the presentation, because genuinely I learned a huge amount. Okay, so I did say we'd have a bit of time for questions and answers, and luckily we can. So some of the questions are appearing before me here on the screen, so I'll start going through them and get the answers from Emer and Merike in particular. So the first one that's on the screen here, it's a question about what evidence there is on early intervention and prevention in youth mental health. So I suppose if I was to sort of put that question more directly, it's this idea of you know, you're observing the difficulties at a particular time. Is it necessary to deal with these sort of things sort of very, very early in life, or sort of, you know, have the conditions of the interventions to make sure that the problematic behaviours don't arise later?
Perhaps I can take it, Alan.
Sure, yeah, thanks, Merike.
Yeah, there is international literature that is highlighting the importance of early intervention. And for example, there is a study by Calisi and others, 2020, that indicates what really matters is also the integration of various support services in that respect. So it would be important to really offer integrated and joined up support to young people from an early age. And some other international studies, recent studies, have also said that the earlier you start supporting somebody and consistently, you know, the better the outcome later on.
Okay, and can I just ask Merike to clarify, are those sort of generalized interventions across all kids, or is there a sort of a policy approach where you identify, you know, possible difficulties for some kids and then start intervening with, you know, targeted at the kids for whom may exhibit later difficulties?
They were kids who presented with issues at an early age, and then the policies were more targeted towards them.
Okay, interesting.
But then, you know, there is some argument as well that by offering support just with targeted kids, it also results in labeling those kids. So again, the way how things are being done matters.
Okay. By the way, Sharon, if you want to, you're on my screen. So if you want to jump in at any stage, just put your hand up.
I wouldn't mind just adding something to that, just
do.
in terms of the department's approach in general in relation to learning and in relation to well-being is a continuum of support. So I suppose for children who are experiencing difficulties, we would have 3 levels of support: support in the classroom, support, additional support in schools, which is provided by SEN teachers, and then you know, there's a 3rd level of support where they may be referred on to outside agencies. But all the time the school is providing an ongoing continuum of support and providing a response to intervention. So identifying a difficulty, putting a response in place, and then seeing, did it work? What's happening here? What do we need to tweak and change? And just in relation to the wellbeing policy, again, and it's a very important point, that we would be recommending that schools implement a whole school approach to wellbeing promotion. Now we have provided statements of effective practice in the framework for practice of the wellbeing policy, which highlights areas for all students, for some students, and for few students, where interventions can be put in place to ensure that all members of the school community are impacted by the policies and the practices. So the universal part of wellbeing promotion is really important.
Okay, thanks. I'm just going to move on to the next question then, and it's about the role of social media, I suppose, in maybe amplifying difficulties the kids are having or reducing them. So, Merike or Emer, any comments about social media?
We didn't specifically focus on this aspect in this report, but our ESRI colleagues have explored that matter further, and there is some other recent Irish research indicating that you know, social media can be a resource, but it also can be a source of concern for some young people that gets overly drawn in and may subsequently then experience negative effects and sometimes resulting in mental health issues.
Okay, next question. It's a really interesting one, and it's about birth order. Okay, so there's a suggestion here. Be interested to explore the influence of birth order on the development of behavior in adolescence. For example, do older siblings increase risk, or do they reduce risk by being a mentor and a source of support for younger siblings? It's a really interesting family dynamic question. Emer or Merike?
Yeah, well, it's a great question. It comes from Aisling, and no, we didn't look at that, and it's a brilliant suggestion for looking at it in the future. I think that whole aspect of birth order and sibling relationships we haven't exploited as much with growing up in Ireland as we could, and that could be a kind of on the wish list for further research, but it is a great idea, and if I steal that idea for a paper, you'll forgive me.
Good thinking ahead there, Emer. Okay, next question. What limitations, if any, do the authors consider may apply to the data set and perhaps to the onwards to the analysis? So just the limitations of the data and the study.
Ooh, that's a hard one, given my other GUI hat. I think that the main limitation, which we did highlight in the report, is our measure of neighbourhood is an electoral division, which may not map neatly onto what people consider their neighbourhoods. So it would be nice to have kind of information at a more granular, if you like, level of area. You know, it would always be nice to have more information on school experiences or other aspects, but like when I think the value is that you kind of can see sort of across domains of young people's lives and how they interact, and even things like, you know, the relationship between parental depression and the young person's own internalizing or externalizing difficulties. I think that cross domain thing is you know, kind of it's a good trade-off for having more in-depth on some aspects of their lives, if that answers.
Yeah, okay. I'm eager to move to the next question because it's another interesting one, and it's from our colleague Helen Russell. So could you say a bit more about the protective factors at community level? Okay, and again, furthering further part of the question, were these the same for boys and girls? And the examples Helen is giving is, for example, sports participation. So I think you get the general sense of the question there, the protective factors at community level. What were they, would you think?
Merike, or do you want me to? Well, I think there was neighbourhood safety. So feeling that, you know what I mean, it was safe to kind of go around or hang around in the area. And that actually emerged as stronger for the young women. So it does seem to be that this idea of personal safety could be a barrier for engaging with local services, you know, on a gender basis. Other aspects were having kind of facilities locally and engagement in structured sports. Now, there were, as you would expect, very significant gender differences, especially by 17, in engaging in those. But in fact, for those young women who did engage, the effects were quite strong.
Okay, so we've an observation in from Merike Canty. I'll just read it. So as a Youthreach worker for at-risk young people between 15 and 20, our holistic model works very well for our students and offers great supports and timely interventions. The Youthreach program is often forgotten about in these studies, most likely due to our position in FET and not second level. If our Youthreach program was offered from 13 years to 18 years alongside second level schools, it would address the main issues highlighted in the study. Youthreach centres are experts in this line of work. Emer, do you have a reaction to that?
Yeah, I mean, Merike probably knows we did some research on Youthreach a few years back. And yeah, I mean, I think what emerged from the Youthreach findings and are echoed here are really the importance of relationships, of having a caring adult in your life, of having a relationship with them, and with the Youthreach staff, of respect and equality and fairness. So I think they emerge as really important, as do the issues of engagement and learning, because that was really important in kind of having hands-on type experiential learning in Youthreach centres. And we have argued for having that variety of learning approaches and types of knowledge exposure in mainstream education, not just in Youthreach. And I think Youthreach has some very good examples of some of the centres have really, as Merike said, the importance of integrated support. Some are really well integrated with local services and provided either in-house access to counselling services or pretty seamless access to external services. And that worked very well for this group of early leavers who have become a smaller group over time, but have more and more difficulties. But obviously, if we were able to provide those kind of supports earlier on, they may not have left school.
Okay. Okay, I'm going to keep moving because time is running against us, but I'm eager to get another few questions in. So the next one, is there any indication in your study that current implementation of well-being in schools is not evidence-based enough? And if so, how can this be addressed? So Sharon, I don't know if you want to make any comment or observation on that one.
Well, I suppose the wellbeing policy is based on international research. It was developed looking at international research, looking at evidence-based practice and what is best practice in schools in implementing a whole school approach to wellbeing. As I mentioned, we use the same conceptual framework as is used in this research, seeing the school as one part of a larger context that the child exists in. And NEPS also, and I mentioned in the presentation, NEPS also implements evidence-based programs in schools and trains teachers in these evidence-based programs. I suppose as a psychological service, we'd be very focused on the evidence base and, only adopt an approach if we feel that it is evidence-based. Can I just add one thing about the role of social media? That is a huge concern as well, and somebody had asked about it earlier. WebWise is funded by the department and has a really good hub for schools and for teachers in relation to safe usage of social media, and I just wanted to mention that as well. I don't know whether, Emer, you have anything else to add on that in relation to the evidence base?
Well, this group of young people would have gone through the system before the renewed emphasis on wellbeing and the curriculum and school self-evaluation, but we're actually going into the field with cohort 08 at 13 very shortly, and we will be surveying their principals in the autumn, and we are going to ask some questions about the junior cycle curriculum and about wellbeing supports in the school. So that will provide a basis to look at this issue further as it evolves on a policy level.
Yeah, sounds like a great opportunity, Emer. Okay, what I guess the next question too is another very interesting one. Is there any sense of the surprisingly high level of poor behaviour in fee-paying schools correlating to cultures of individualism, lack of social solidarity? So who'd like to have a go at that?
I'll bite the bullet.
As a Christian Brothers boy now, I'm kind of enjoying the tone of the question. So
okay. Yeah, we've struggled with this. We don't have a convincing answer. I think some of it is opportunity, because we are seeing differences around some items like taking money or possessions from home or from school. And obviously, if there is more money or possessions around, you know, that could foster that. But there are other items like getting into trouble for acting out in public and stuff that we can't readily explain. I mean, the individualism, I'm not sure. We did further work to look at, you know, is there just one or two schools in the sample? And it wasn't. So definitely it's something that bears further investigation.
Okay, we'll take another couple of minutes and might get another couple of questions in. From Carmel Hannon, in terms of neighbourhood effects, were these measured at wave 1 only?
Yes, actually, we only had the matched of the small area population statistics for wave 1, but in the analysis we included dummies for mobility between waves. So we knew if the people had moved. So by controlling for that, we were partialing it out. Ideally, you know, and we would hope down the line we'd be able to get more matched data with the CSO Corporation, and that we could look at actually, you know, what happens if you move between a very deprived area and a more advantaged area over time. Does that affect patterns?
Okay, now, sorry, I'm just more on the links with Youthreach are coming through a lot in the questions. So another one here, can any aspect be related to the findings in the ESRI's 2019 Youthreach report? So I know you were involved with that one, Emer. So
yeah, I think just kind of reiterating a bit what I said earlier, I think a number of aspects like kind of the importance of relationships, of one good adult, of having flexibility to adapt learning to the needs of the learner, and to having access through the Youthreach Centre or through a school to specialist support where it's needed.
Okay, and this might be one for you, Sharon. I'm not sure you're going to be able to answer it though. The question is there any recommendation to extend the SEN budget, which currently applies to 20 Youthreach centres, to all 112 approximate centres? And does Youthreach get recognised for its work in this area in the report? So if that's somewhere between Emer, Merike, and maybe not you, Sharon, I don't really know, but
yeah, I mean, unfortunately, the numbers specifically in Youthreach, well, they wouldn't have been there by 17, but even as this cohort became older, the numbers are too small to identify separately. We did raise those issues around extra funding for SEN provision in the Youthreach study. So we can't kind of add to that, but we did find an area that we didn't highlight here because it kind of deserves its own attention, is the kind of very significant differences between young people with special education needs and their peers across all domains of behaviour. And so definitely, you know what I mean, those supports would need to be in place in mainstream and Youthreach settings accordingly.
Okay, and maybe we'll take it as a last question. Did bereavement emerge as a factor in any of the behavioural patterns? And maybe extending that, and I think you did touch on this, issues of marriage breakdown, relationship breakdown, or whatever like that. Can these be triggers for difficulties?
I mean, they could, and we could look at that more. We do have a lot of the aspects that would be considered adverse childhood experiences, like bereavement, parent or other family member, as well as things like parents in prison, parent mental health, though we did look at parental mental health. But the thing is, growing up in Ireland is so rich that we're just trying to hone in on a small set of factors and look at them consistently. You could really, you know, there's just no end to the aspects you could explore. And I think bereavement would be another one. To my knowledge, we've very little of that in the Irish context.
It's interesting. Sharon, do you want to comment on that one, the bereavement plus relationship breakdown?
Yeah, just in relation to bereavement, I suppose it is you know, unfortunately, it is something that schools are very used to dealing with and responding to in students, because, and you know, we've had a number of really high profile, difficult incidents, but on a day-to-day basis, people die, children, young people are struggling with the loss of loved ones. So from the department's point of view, we have a very extensive supports for schools in relation to critical incident response and guidance for schools on how to respond to the death of somebody or a bigger incident. So we have a critical incident guideline that is available to all schools, and at the moment we do train teachers in critical incident response and have been doing so for a number of years, and at the moment we're piloting it at the moment, an e-learning module on critical incident response, which, you know, will look at all the different areas of loss, bereavement, tragedy, etc., and highlight the resources and supports that are available within the system. So you know, we're quite excited about that, because it'll have a far reach, rather than NEP psychologists going into schools to develop to provide this training. We hope that it'll be available to schools to access when suits them. So yeah.
Okay, great. Thanks for that. Okay, so we're moving on to 3:10 now. So I think we should probably draw things to a close. So again, Sharon, let me thank your good self for coming along, and in his absence, I'll thank Minister O'Gorman as well. As ever, I'd like to thank our colleagues in the Department of Children for their collaboration generally in GUI, and then on the particular research programme that we're engaged on at the moment. I want to thank everybody who's logged on today and people who submitted questions. Unfortunately, I couldn't get to all of them, but I'm guessing if you want to email Emer and Merike bilaterally, I'm sure they'll be very happy to take questions, and I think you will be putting the slide presentations up on the website later, so that'll just be another opportunity for people to reflect on the work. And then finally, I want to congratulate Emer and Merike for a fantastic report, a really good presentation, and really good engagement with questions and answers today. It's just been a very, very enjoyable and informative event, so congratulations to you both. So with that, wish everybody a good afternoon, and hopefully we'll be talking again soon. Okay, bye-bye.